Hi, Dr. Weeks here, and I need to talk to you about gluten sensitivity, leaky gut, autoimmune disease. You know, this is so widespread. Literally 90% of people that come to me with poor health are suffering from gluten sensitivity and don't know it. And so what I need to explain to you, if you're out there and you're suffering from poor health, I want to tell you the truth about gluten sensitivity and how it destroys your health. Here's the problem. What's happening is we are creating new proteins never before seen on Earth. This is what genetically modified foods is. It's literally the mutagenesis, the creating of new proteins. The problem is these proteins have never been seen before by the human body. And so what's happening is our bodies are reacting to them. It doesn't know how to digest these things. And so when we eat things, especially gluten, our bodies begin to not be able to digest it. And so many people, they come to me and they're eating gluten, and what's happening, because their bodies can't digest it, it's creating irritation in their guts and digestive tracts. Over time, this irritation is creating inflammation of their intestinal walls. Once the inflammation sets in chronically, we literally get breaks in the walls of our small intestine skin, which is only 1 or 2 cell layers thick. Once we get a breakage in this skin and the proteins get into our blood, this is when everything starts to go downhill rapidly. Our body begins to react to these proteins, and it marks it as a foreign invader, almost like a virus or Ebola, and our immune systems feel like it's being attacked, so they go into full-on defense mode. This is when people begin to just basically get burnt out. And so most people, they go to their doctor and they beg their doctor. They say, I don't know what's going on, but every time I eat bread, I feel lousy. In fact, studies have shown that most people have to ask their doctor to do a gluten sensitivity. But according to the American Autoimmune Association, only 12% of doctors are even familiar with the mechanism of autoimmune disease, and only 4% of doctors actually feel sufficient to make a proper diagnosis. This is crazy. This is crazy because according to the surveys, 75 million Americans are walking around with autoimmune disease and gluten sensitivity, and it's just destroying their life. Once you get leaky gut, your health begins to rapidly go downhill. It burns out your adrenal glands, it burns out your immune system, it creates brain fog, it creates a numerous lowered immunity. It creates muscle pains and fibromyalgia and heart disease and cancer, because literally your body is in this autoimmune civil war. And so let's talk about why this is. Well, here's the first problem. When people go to their doctors and they ask their doctor, please check a gluten, what happens is the doctor usually only checks one peptide called alpha-gliadin peptide. This is the most common peptide in gluten. But there's actually 62 different peptides that you can become allergic to, and most doctors check just one of them, just one. And so if you're allergic to any of the other 61, your doctor comes back to you and says, you do not have gluten sensitivity. This happened to me. This happened to many of the patients that I've gone to. They go to the doctor and they get a blood test. The doctor comes back and says, don't worry about it, it's not gluten. People go home and they think, well, I'm crazy because every time I eat this, I feel bad, but I'm not allergic to it. And so here's what we have to discuss. First, how do you test if you have gluten sensitivity? The first and most effective way of testing gluten sensitivity on Earth is muscle testing. Muscle testing is a way of seeing if a product weakens your body. I always tell patients and people that come to me, substances that we consume can only do one of two things. They can either weaken us, which means that they're damaging our immune system, they're not feeding our cells, or they can strengthen us. They're filling a deficiency. It's something that our body, our cells want. And so if people hold or taste gluten, and I test a muscle and it weakens them, it is a definitive 100% accurate test that you have a gluten sensitivity. And so most patients that come to me, I do test them. I show them that it weakens them. So the first step is simply removal. Get it out of your life. And what we encourage patients to do is to get it out do an elimination period for 21 days. This is part of the DNA reset that we do on almost all of our patients. If during that 21 days you come back and you say, wow, my life is changing, my brain is clearing, my nervous system's getting better, I'm getting healthier, well then you can be assured, 100% accurate, that you were sensitive to gluten. And so what's the next step? Are we committed to avoid these foods forever? Once you have leaky gut, most often to gluten, but also other foods, dairy, corn, soy, nightshades can all do it, and you need to get muscle tested to all of these things. Once you find out what you're sensitive to, you do have to get it out. Studies have shown that once you damage your gut, it takes a full 2 years for your skin inside your intestines to regenerate. During this period of time, there's lots of things that you can do to heal yourself. One is to begin to take enzymes to make sure that you fully digest the foods you eat. The second is to try to seal your gut. Here at Whole Body Health, we produce a supplement called Leaky Gut Seal, which is literally all the nutrients you need for those junctions to bind up again. Once you seal your gut, you still have to try to remove the body's autoimmune reaction. This never goes away. Imagine an allergy, much like somebody who's robbing your house. If you came home one night and somebody was breaking into your house and you saw their face, most likely you would never forget it again. This is what the body does. It recognizes gluten, it recognizes dairy, and it says, if I ever see you again, I'm going to ramp up my immune system and go in full-on attack mode. And so if we need to reset the memory of the body, you can do this. And this is so exciting. It's life-changing. It's called allergy elimination technique. And basically what it is it's a way of resetting your body's memory. And what we do when people come to us and they have food sensitivities is first we muscle test to find out what food sensitivities they had. And then we reset this. Going through the DNA reset is part of it. We got to get the foods out for 21 days. We have to rebuild your digestive systems. We have to build up your body after it's been weakened. But just as important is allergy elimination technique. This is something we do at our office, but it's basically this. If you hold a food that you're sensitive to and balance your nervous system. We do this through acupressure and adjustments. And you hold this while getting work done, literally your body will reset. We're resetting your nervous system while you're in contact with this. The first time I was introduced to this, I was like, no way, this is crazy. This can't work. You can't get rid of allergies. But amazingly, you can. It's all just a neurological response. An allergy elimination technique, especially the way that we do it, with adjustments and acupressure, is a powerful way of getting your body to forget these allergens. And so let me summarize. If your health is not where it should be, you're probably one of the 75 million Americans that's suffering from autoimmune disease. You're probably eating foods that are undigestible, partially because many of them are genetically engineered to be undigestible. You've probably damaged your intestinal linings, and your body has probably turned on an autoimmune response. If this is the case, the best thing that you can do is to get checked through muscle testing. Go to a professional who knows how to do muscle testing and see if they weaken you. If they weaken you, get them out of your life for 21 days. If you're unsure of this and you're just like, well, what do I do if I can't find a kinesiology doctor to muscle test me? Simply just do an elimination. Cut out gluten and all gluten products for 21 days and see if your symptomology gets better. If your pain gets better, your brain fog, your fibromyalgia, if it does, you're guaranteed that you have it. Once you have it, you can reset it with allergy elimination and you can rebuild your gut and the damage that's been done through digestive enzymes and leaky gut seal. I hope this information helps. I hope this answered some questions that you need, and if you follow my direction, it will change your life. Thank you.